Joining us this morning to talk a little bit about conditions here at Salem Regional Medical Center is Dr. Erin Philpott and Dr. Brad Greenberg from the hospital. Good morning, doctors. Good to have you here.
Good morning.
Good morning.
There they are. Thank you for joining us. And again, I know Megan and I both have a lot of questions for you, and so we'll get right to it.
Yeah, so recently, as recent as October 5th, actually, the CDC put out some revised guidelines on the aerosol question. We know there's droplets, and we know that there's a question about aerosols, and especially as we move into colder months and we start gathering inside enclosed spaces. Can you speak more about that?
Yeah, sure. This has been something that has continuously come up with COVID since the beginning of the pandemic, and sort of the implications of these two different modes of transmission for us in the hospital, but as well for the general public, and what exactly they mean. And I think we have seen cases really across the world that demonstrate there was probably an airborne transmission component or aerosol transmission in the choir in Washington, and then I think there was like a gym in, I believe it was South Korea. There was a restaurant in China. So a number of different cases that really were quite compelling for probable airborne transmission. I think it gets a little bit complicated. People like to really call it black and white. You know, does this need an N95 or a surgical mask is the big question in healthcare, of course, and then go from there. But the idea here is it's really a continuum, and you know, some define aerosols technically as less than 5 microns, and others define as droplets as greater than 5 microns. But the idea, the most important pieces to it are that the droplets fall out of the air with the viral particle in it within 6 feet. So, and that's where kind of that 6-foot distance rule comes from. Or maintaining that social distance. Whereas aerosols, they basically leave a little bit of the virus hanging in the air for a period of time. And scientists have been able to pull it out of the air. And then the question becomes then at that point, yes, it's airborne. Probably a lot of respiratory viruses are. But then how contagious? Is there enough virus in the air to actually get it? And that's where it gets a little complex. So the CDC releases this update to their transmission, information surrounding transmission of SARS-CoV-2 just on the 5th, as you said. And it's not really new to us, but it's just more formally described by the CDC as they've integrated all these different cases and the data behind it. So still, surgical masks, everyone masking will significantly reduce that projection of virus into the air. And those social distancing measures are still very important. And droplet transmission is thought to still be the primary mode of transmission. And it may be that some people, these super spreaders that we've talked about before, are the ones that are, for whatever reason, have the propensity to aerosolize, whether it's the virus in their body or how they talk or how they sing. But certainly that risk increases inside poorly ventilated spaces and in close contact with individuals who have COVID-19. Do you have anything to add, Dr. Greenberg?
I just think that it's important to emphasize here that really the mode of transmission is thought to be, you know, by far predominantly associated with large droplets. And so that's the first thing. The second thing is that if we look at the recommendations of the state of New Mexico and what our organization does as far as universal masking, wearing a mask all the time, regardless of distance, and trying to engage in social distancing practices, both of those things will significantly reduce risk of transmission by either form, by either droplets or by aerosols. And so I think I think it's important to acknowledge that in some of these cases, like Dr. Philpott mentioned, it's hard to explain away transmission that must have occurred by aerosolized particles. But I also think that the research is ongoing, and we at San Juan Regional Medical Center just considered this very topic as far as whether or not we needed to modify some of our processes. But after a thorough review, we're going to stick with our processes, universal masking, universal eye protection in clinical areas, and select deployment of other kinds of respiratory protection in areas that are higher risk. So I think that it's very important for us to stay on top of changes in the science, and we will continue to adapt to meet the needs of all the folks in the four corners.
Great. And so this is a real pertinent question for Scott and I. Does this mean we get a free pass on gym guilt this year?
Gym guilt.
Gym guilt. You don't have gym guilt every year?
I
No?
think
You've met me.
you definitely do.
All right. Okay. Great. Thanks, guys. And let's switch gears to treatment questions. Obviously, we've had big news recently, and Remdesivir has come back up into the news. So what is the status on different treatments that are being used?
Yeah, so, not a lot has changed on the treatment front. Unfortunately, we don't have any great novel therapy that has shown very promising benefits. I think, of course, Remdesivir has come up because of President Trump, but, we've been using that now for several months. The data behind that, the, high quality study of the randomized control trial demonstrated that you have a decrease in duration of illness, a slight decrease, but otherwise didn't really demonstrate a really strong mortality benefit, though did show a trend towards mortality benefit, meaning it may save some lives. So we've been using that pretty consistently throughout. That still, does not have formal FDA approval. It's under the emergency use authorization. We've really I have not personally seen many side effects, certainly no serious side effects. I think we've had to stop it 2 or 3 times in patients in our hospital, and we've given many, many doses. So I think overall, as demonstrated in the studies, it's pretty safe and well tolerated by people. Convalescent plasma, it too received emergency use authorization based on fairly limited data. So we have not been currently using that in our hospital just due to the lack of data to suggest that it is high yield, and our COVID cases have gone down, though they're going back up again. And then I think that the interesting thing that has come up with Trump is the use of steroids. And that is probably the single most effective treatment in patients who are hospitalized requiring oxygen, meaning a very large randomized controlled trial out of the UK with several thousand participants demonstrate significant mortality benefit. So it literally saved lives when given. But the interesting thing is there was a negative signal, meaning that it might actually do harm among people who are not in the hospital or not requiring oxygen. So I think that's just a little bit interesting that Trump did receive it. So he likely was ill enough that his doctors thought he probably would benefit from it. And then there's some other treatments still in the pipeline, a number of studies going on, but nothing new and wonderful yet.
Got it. Thank you very much. Interesting. And so these treatments, I guess, they're not necessarily cures, but they are treatments. And so they are just these steroids and the other drugs that we're talking about. They just kind of help the body then to try to recover from this infection. Is that the best way to describe it?
Yeah, that's exactly right, Scott. It's much like flu. Like strep throat, you get penicillin and you feel better after 24, 48 hours. It was a magnificent discovery for us, but we don't have any magic bullet for viruses. They're difficult to treat. Flu, we give Tamiflu, and that, again, helps shorten the duration of illness, similar to Remdesivir, but doesn't significantly change the course or the outcomes. So it's really what we call supportive care. And we, as physicians and the scientists, are still trying to figure out the most optimal timing for each of these medications, whether people are in this viral replication phase, so earlier in the course of the illness, where they might benefit from Remdesivir and convalescent plasma and other medications that might decrease the viral load and prevent the damage, incurred by the virus, or the steroids that are given later in the course of illness when people are in that inflammatory phase. So it's a complicated situation with coronavirus and figuring out how to best support people through it.
Sounds like it for sure. I'm sorry, Dr. Greenberg. Go ahead.
I was just going to say that this isn't a novel kind of challenge. Like within medicine, the use of steroids and kind of modifying inflammatory cascades is definitely apparent in a number of other things. And controversies with this particular kind of intervention, this particular kind of glucocorticoid or steroid interventions has existed for a long time about a whole range of different problems. Some of them inflammatory and infectious, like sepsis. Some of them injury-related, like spinal cord injuries and whatnot. So this is science at work, and I think it's important that we approach these things in a manner that opens up certain therapies for compassionate use, which is the term before you get to EUAs, if you have a promising therapy. But at the same time, we need to make sure that all these things remain under a intense scrutiny to make sure that the science bears out the fact that they're effective, and also it supports their use despite any other apparent risks. So I know everyone wants a magic bullet. Everyone wants this to end, but this is how it's done. It's a slower process. We'll try to find the right constellation of therapies that are meaningful and that don't cause harm. So the one therapy that I did want to mention, which has been in the news recently that we didn't touch on, was this so-called antibody cocktail. It's two different monoclonal antibodies. So are basically antibodies that are made in a laboratory that are basically built to combat COVID-19. I believe there's 2 strains within the Regeneron product, and that is currently under compassionate use. So I'm not aware of a specific EUA for it, but I think that the president did receive that particular therapy, and it's still under study, and especially under study as a potential therapy early in the course of the illness that may help with sort of combating the COVID virus after it's detectable, but really before there's a significant immune response mounted by the patient or the host.
Very good. And we did want to ask about cases. So we've noticed there's a decline in cases in this area, but there's some surging in other parts of the state. Is San Juan Regional at a state where there's enough sort of openings to receive patients if needed from Albuquerque and places like that?
So we are actually in we're poised to be able to adapt. Because we've actually we had a really big surge of cases in April and May. We had another smaller bump in July, and then it's essentially been declining since then. But we've actually, over the last, say, 7 to 10 days or so, noticed an increase in the number of cases and increases in the number in our percent positivity for the tests that we're performing. And so we still have plenty of capacity to care for those. And the state of New Mexico, especially in the spring, did a fantastic job of really working collaboratively amongst a whole range of different hospitals and healthcare systems to move patients to areas where there were resources to make sure that we didn't have, the excess mortality or people die when there are resources elsewhere in the state. So we remain engaged in the statewide effort, and if we need to receive patients from hospitals that usually refer to us as a hub, we're ready to do so. And if we need to look at unconventional transport patterns to make sure that we can always match up the patients with the needed services, we'll be there to help too.
Good to know. And I think you're right that that process, that system that was in place here from the spring seems to have worked out pretty well for our state, which we're all very grateful for. Just maybe one final question, doctors, we wanted to ask about these cases that you are seeing. We've heard that maybe the cases that are being presented at hospitals around the state and around the country are maybe less severe than maybe they were earlier on, say in the spring or so. Is that something that you can confirm here locally or not so much?
Yeah, that's a great question, and I think this is really, we don't have any solid data on this or have looked specifically at, how much oxygen are people needing when they initially present, et cetera, or kind of formally comparing. But I do think my feeling is that we are seeing a slow rising tide, very similar to what we saw in April at the start of our big surge. And we're seeing people with more mild illness. I think some things that could be driving that perception that people are presenting with more mild illness, or people are coming in earlier. They're more aware of the ramifications or sort of how the virus can present and progress so rapidly. I think people are less fearful of being out and going to the hospital in general, so they're not waiting till they're extremely ill before coming in. So people may be presenting just a little bit earlier, which is sort of casting that perception of maybe they're less ill. But from my personal experience working over the last couple of weeks, I'm certainly starting to see admitting those patients who are on high flow again, which is, the need for a large amount of oxygen. So I think the cases are probably just as severe as they have been. And I think we're also getting more accustomed to it too. Any thoughts on that, Dr. Greenberg, what you've observed?
What I've seen is people are, I'm working in the emergency department and whatnot. I think that people have become more comfortable coming to the emergency department for these complaints. We're starting to see a couple people actually even come through the outdoor area just to get a test. And so I think that the folks I think symptoms are coming back. But I do think that this isn't all folks that are just going in the outpatient setting. Our ICU remains intermittently busy on where we're taking care of COVID patients. And so I think that the important message is that despite what you may hear in the media, or in a lot of different news sources here, the virus itself has not changed. And what we can control is our behavior and the likelihood that we would have to actually get the illness. So we all hope that this is going to wind down and that we could get back to some semblance of normal. But I think right now it's very important for everyone not to let their guard down and to try to be disciplined about just normal COVID-safe practices that we've tried to adopt over the last 6-7 months, and to stick with those, especially as we get to colder months where we're likely to be closer together. And I really hope people can think about these kinds of principles when they're starting to make their holiday plans, because I think it's really important to think about making the right choices, how to engage with friends and family, how to make sure that you're staying safe, and how to make sure that everyone is aware of and trying to keep their friends and family safe and healthy as well.
Great advisement. And so one final question, speaking of advisement, generally flu shots, I know it's highly advised that we all get them for every other flu season. Is that still the case for this one? And are there demographics that benefit especially from the flu shot?
Yes, more important than ever to get your flu shot this year for so many reasons, for your own health and reduction in severity of flu if you get it, or prevention of flu, potentially if it's a great match, but also to help us and help everyone around you and us in mitigating or reducing those flu-related hospitalizations, which the flu shot is very effective at doing, in order to make space and have plenty of room for not preventable illnesses like coronavirus or heart attacks or strokes and everything else. So more important than ever to get the flu shot this year.
Very good. Well, doctors, we again thank you so much, both of you, for calling in to talk to us and our audiences about the work that you are doing. Again, we thank you. You both are on the front lines there, so thank you very much.
Thank you, Scott and Megan. We really appreciate it.
Thank you.
Thank you both.
Thank you, Dr. Philpott, Dr. Greenberg from Salmon Regional Medical Center. We appreciate both of you, and thanks for calling in this morning.